This is an example of inserting the HYDRUS stent. This version goes suprachoroidal at first, and then we're going to take it back out and put it right back into the canal where it's supposed to be. And so here I've got the head tilted and the eye tilted about 20 to 30 degrees. I start by making a small incision with the tip of the HYDRUS injector. That just makes it easier to insert the actual HYDRUS itself. Here I'm working through the main wound instead of using one of the paras. So right now I'm going to slowly roll the HYDRUS anterior. It looks like it's going into the correct spot. And so initially I feel good about this insertion. I'm then going to grab the tip of it with the injector and help to rotate it completely into the canal right here. So here's that movement. And so I like my HYDRUSes probably more into the canal than what they recommend. But here I'm looking at it, and the angle of that HYDRUS and the way that it's sticking out of the canal just doesn't look right to me. So I'm going to take my viscoelastic, I'm going to inject a little bit just so I get a cleaner view. And here is where I'm noticing that I can no longer see my stent after about the first clock hour, which tells me I've probably gone suprachoroidal. And so I don't want to leave it in this position if I can avoid it. And so I'm going to use the injector again to pull out the stent. And so if you roll all the way forward, you get that kind of alligator mouth there. And I'm going to clasp it around the stent itself. I'm going to hold it very steady as I retract this thing back into the injector. I'm then going to make a secondary incision in front of or lateral to my first one. And I'm going to go through a completely different spot. Because if I try the same incision, it's just going to follow the same path. And so here, as I'm injecting, I can see those eyelets rolling into the canal there. Sadly, I'm going to roll a little bit off screen here. I'm going to use the viscoelastic injector here just to move that air bubble out of the way so I get a better view. Then I grab the HYDRUS injector and I'm going to use that to push this stent into position where I want it to be. And right here I'm just confirming location. Harder to see in the video, but I can see the eyelets of that stent there in the canal. So that's a nice way to switch over positions when you at first insert suprachoroidal. Thank you for taking the time to watch this video.